This is Open Mind Alexander Technique. I'm Jess. Today we're talking about a pretty common complication that can impact people's movement that I end up working with as an Alexander Technique teacher, and that is a pinched nerve somewhere around the neck and shoulders area. So this is going to be the start of a few videos on specific medical stuff that people can come in with sometimes that's impacting how they organize themselves and creating complications on, well, there might be some limitations on what you can do. There might be some limitations on how well you can organize yourself around this. Now, before we dive into this particular one, we need to have a quick conversation about why is it that a non-medical person is talking about medical issues. So let's get really clear on this. I don't treat medical issues. These are simply complications that people bring in with them as they're trying to work with their movement, as they're trying to work with their habits on how they organize themselves, how they carry themselves, how they sit, how they stand, how they bend. And so as an Alexander Technique teacher, part of my job is to have pretty decent functional knowledge of what are common medical issues that people have. What are some things that are going to be barriers to be able to organize themselves well? In this case, a pinched nerve somewhere in the neck and shoulders area is one that I've had quite a few students come in with and have issues with. This is actually a pretty common one with musicians because of the amount of repetitive stress that goes on frequently in the neck and shoulders in conjunction with playing an instrument. So today we're going to talk a little bit about how we approach that and how do we find these, proper boundaries where, no, I'm not treating the issue, but you might find that the side effects of this issue can actually be managed a lot better when you're organizing yourself consciously. So a couple different cases that I've had where I've worked with pinched nerve or nerve issues in the neck and the shoulders have been folks who, for example, played a string instrument, violin or viola, where they're like this all the time. And this is something that we can work with a good bit to say, okay, how can we address your playing technique so that it's less likely to cause those problems? And that lets your body do its own healing. I'm not doing the healing for you. You're doing the healing. I'm just helping you learn how to get out of your own way. Another thing that can come up is if someone's habits are to pull their shoulders down. That one can be counterintuitive for a lot of people, and I find that this is one that I don't hear often enough from medical folks, and I wish I did. When your habit is to pull your whole shoulder girdle, this whole area down, it can pinch a lot of the nerves that go in between the neck and the arm, as well as in the neck and the torso and the rest of the body. One of the biggest problems that can come up with that is a student that I've worked with a good bit who has something called thoracic outlet syndrome. So what that is where a nerve comes out from your spinal cord. It crosses underneath in between your collarbone and your ribs and then goes down your arm. And if that gets pinched in there, it causes potentially really severe symptoms. Some people get lucky and it's just some mild tingling or something every once in a while, not a big deal, but it can really escalate. I had a student who had this severely enough that he had done all of his medical treatments and the years of physical therapy and all of these different things. He was on constant pain meds to try to handle his pain symptoms. And his next medical intervention, the next treatment, was a controversial one. He said that there was quite a bit of pros and cons from the medical community about this, was actually to go in and surgically remove his first 2 ribs so that there wouldn't be that pinch between collarbone and the ribs and all the muscles in that area and everything going on in there. What I found with this particular student was that he had a very strong habit of pulling his shoulders down. And so a lot of the way that I worked with him on this was in being able to release those pulls down. So in the same way that we can pull up, which is really in the neck muscles, that pulls the shoulder up. So on me here, Muscles can only pull or release. They can't push. So remember that, starting that with our basic mechanics and functional anatomy knowledge here. It can only pull, it can't push. So where's the pull to do this, to actually raise my whole shoulder girdle? Well, the pivot point for this is actually at my collarbone, where my collarbone connects to my sternum. And that's right here on me. On Stan, that's this. This is a movement joint. People don't talk about it a whole lot, but it's definitely a movement joint. If you take your hand and lay it flat so that the base of your hand, the heel of your hand here, is right on your sternum, and then just flop it across your collarbone, shrug your shoulder a few times, take it forward and backward, you'll feel that move. Unless you have some sort of, again, medical issue that limits this, in which case, don't do that. Please take care of yourself. But if you don't, and you can move this around freely without hurting yourself, go ahead and try it. And now, I want you to force it down. Where do you feel that? I feel it in my torso. So I feel it actually on all sides, but especially under my arm and kind of the armpit area and in the back. So if we're looking at neck and shoulder anatomy here, there's a couple things that are different on Stan because he's made of plastic. Stan has bolts here between his shoulder blades and his torso. You do not. There's no bone-to-bone connection between the shoulder blade and the ribs. This whole thing can move, and it does move. When you shrug your shoulders, this whole area moves up and down like that. Because here's the shoulder blade going through, this is part of the shoulder blade that comes forward, and that's where it connects to your collarbone right here. So all of the sides of the shoulder are actually connected to the shoulder blade. Sorry, I said that unclearly. All of the sides of the actual shoulder joint. So this ball and socket joint where your humerus bone comes up and meets a socket, it's actually just shoulder blade. Even this bit that reaches forward is part of the shoulder blade that goes right through. It's very hard to feel all of this on yourself because we have so much connective tissue and muscle and protective stuff in there. So if you're gonna shove your fingers in there, just be gentle, be careful. You can hurt yourself doing that, so take it easy. But if you kind of play around with it, you'll start to feel that there's a difference between raising your shoulder, as in including the collarbone and the shoulder blade, versus raising your arm. So on Stan, I can't raise his whole shoulder because this is bolted in place, but I can raise his arm. So the difference would be the collarbone and shoulder blade going up and taking the arm with it versus doing this. These are different movements. Now, at a certain point of raising the arm, yes, the shoulder girdle will get involved and the shoulder blade will rise and the collarbone will rise a little bit, but that's pretty high up there before mine actually really starts to need to move. It can be really helpful to dive into this basic functional anatomy stuff so that you understand how are you built, how does that work, how do you function, and how can you use that knowledge to learn how to leave yourself alone. So when we're dealing with something like a pinched nerve in the neck, in the shoulders, a lot of what I work with people on is de-escalating and getting out of the way. So again, we need to be clear and differentiate here. I'm not treating the pinched nerve itself. I'm teaching a set of skills to help a student learn to not make it worse, basically. And then from there, they tend to do a lot better with their medical treatments, things like physical therapy, steroid injections, things like that. And that might escalate all the way up to surgery. I don't tell students to avoid surgery. There are some Alexander Technique teachers who do, so I just want to acknowledge that. I'm in the camp of course people are going to try to avoid surgery if they can. Everyone tries to avoid surgery if they can. So do the medical folks. But there are certain things that you can't do anything else with that. You do need to get in there and physically change something. We can be selective about that, and for something like removing ribs 1 and 2 on both sides for my student who had thoracic outlet syndrome, that would make me extremely nervous, because in his case, this is someone who habitually pulls this whole area down, so all that's going to do is give him more room to pull the whole thing down, which is going to stretch out that nerve in the first place. And I personally think that that would probably create even more issues for that student in particular, because when that nerve got stretched, that was when he would experience his worst symptoms. So if you're basically just giving those internal hard support structures less support, it can just stretch even more compared to the neck, and I think that that would actually make symptoms worse. So when we're dealing with nerve pinching, learning to get out of the way, learning to minimize the amount of bending in the neck especially. Now, the neck isn't actually really anatomically that different than the spine below it, it's just not surrounded by ribs, so it tends to be a whole lot bendier than our thoracic spine. So when we're looking at doing this a lot, for various different movements, athletics, gardening, lots of different things that can involve a lot of bending in that way, one of the things to look at is, how are you doing those movements? So we work with bending. We work with kneeling, we work with squatting. We work with being able to raise the arm without having to pull in the neck and the shoulders. And that's one of the things that actually can be really quite difficult for people. I find that with my musician students in particular, especially strings, violin, viola in particular, if you prevent them from being able to lift their left shoulder where the instrument rests and say, okay, we're just going to take a moment, this is not how I want you to play all the time, we're just going to open this up as a new possibility for how you can move, let it just rest on your shoulder. We're not going to use the strings at all, we're just going to practice holding an instrument and just bowing on open strings to see what can happen can we even start to learn to do less in this shoulder. It's incredible. I've had students just look at me in panic and say, I can't, I don't know how to do this. It's like I've never played a violin in my life. It's so cool to see how people's brains just kind of short circuit when they're faced with an activity that they've done habitually for years and years and years. Generally, by the time they get to music school at a place like this, it's been a long time. To ask them to really leave that habit behind and just have, okay, here's a noise maker, it's resting on my shoulder, and I'm just going to lift the other arm and do this. It's incredibly difficult. So that's the kind of thing that we work with in Alexander Technique. I cannot make any promises whatsoever about the medical benefits that will have, because the only thing that I'm doing is helping someone with their organization of their self. There are times that people have had incredible results from something like that. For example, my student with the severe thoracic outlet syndrome came in one day and told me, suddenly I've been able to start tapering down on my pain meds. And I hadn't even talked to them about that. I hadn't talked to them about his meds at all. I didn't even know he was on them. And he came in one day and said, I'm doing better enough. I'm starting to taper down on my pain meds. And, I can't make any recommendations on like, oh, here's the pace of this, anything. Like, you talk to your doctor about that. I have no experience with this. But it was hugely helpful for him to start to get some space under there, to start to not pull down all the time or in. So, a couple pieces of advice that I've worked with folks who have nerve pinching and nerve stuff going on in the neck and the head, and the neck and the shoulders, is thinking about 80s shoulder pads. It's kind of a V shape, up and out, right? Allowing this up and out to be there so that you're not pulling yourself in or down. Allowing that space to be there can be really helpful. Another tool that we can use is working with the breath. So if we look at, again, looking at our basic functional anatomy here, first rib is all the way up to here. And notice that on the side here, on the side profile, you can see The first rib is actually above the collarbone in the back. It forms an X with the collarbone. Make sure we're at a good angle here. So first rib attaches below the collarbone in the front, and then forms an X and swings underneath the collarbone, and then comes up above it in the back. All your ribs have to move when you breathe. Even that one. So if we work with some breath exercises, breath release, being able to just allow breath to come in and out, it can actually be tremendously helpful for freeing up some of these muscles that tend to get quite tight around the shoulders and the neck. So on me, to give you an idea of how high that is, here's my collarbone. Right in here, I've got lung tissue. The only thing underneath the ribs in this area is lungs. There is lung right there. This will vary just slightly depending on the person and your proportions and how much the shoulders slant. Stan here is just one example, and he's molded from a real person, so he's got his own uniquenesses and idiosyncrasies. But in general, you have lung above your collarbone, at least in the back. Most of your lung tissue is actually behind this side midline of your torso, so it's actually most accurate to say you breathe with your back. So we can work with that. We can work with learning to let go of it, to not force the breath, to use our innate breathing fluid dynamics and pressure systems to help breath be able to come in and out on its own. That's something that I will talk about a whole bunch in future videos, but I just wanted to bring it up as an example of here are some of the things that can be really helpful when working with nerve stuff in the neck and the shoulders. Along with that is making sure that when you're doing something like your physical therapy stretches or exercises, strengthening things that a PT might have you doing, make sure you're not holding your breath. When you hold your breath, it actually is a muscle tightening. And especially for a lot of people, that's going to tighten around the neck and the shoulders. So, as you're doing your stretches, strengthening exercises, stuff like that, keep checking in with your breath. Make sure that it's still coming in and out, asking your shoulders to relax, but not to pull down. Thinking about your 80s shoulder pads up and out, and still allowing that soft, easy connection between the neck and the head so that these neck muscles don't grab to try to squeeze the skull to go back and down. So if anyone has any particular questions on, hey, I've got this exercise that PT has got me doing, do you have any recommendations for that? Feel free to leave a comment or get a hold of me somehow, and I'll be happy to help. I hope this is a helpful look into just one of the interesting barriers and complications to free and easy movement, and we'll look at a few more in the future.